All right, Dr. Kende Elisha speaking here. Today we're going to be going over respiratory system. We're going to go through common things to manage as nurses. I know a lot of nurses struggle with respiratory system, but this is going to be short, sweet, and to the point. I'm going to be talking about medications that we use in treating certain conditions. I'm going to be talking about your role as a nurse, the complications that patients are likely going to encounter from the pathology and so on and so forth. And at the end, I'm going to be talking about the drugs that we give for specific conditions, and then the common side effect of those drugs, the potential interaction of those drugs, and what kind of things to teach. Those are areas that students tend to struggle. So we're going to jump right in. Dr. Kende Elisha speaking here, founder and CEO of MP Certification Academy. So the very first issue we're going to talk about is asthma management. So with asthma management, what medications do we normally use? First of all, I know we go through GINA guidelines. I'm not going to go too deep into guidelines. But by GINA guidelines, you want to do SABA, which is called short-acting beta agonists like albuterol for acute symptoms, inhaled corticosteroids like fluticasone for long-term control, leukotriene modifiers, example Montelukast, are some of the few meds that we use in treating asthma. So as a nurse, what are you supposed to be doing to support this person? Of course, we're supposed to educate on the technique to use inhaler. You have to know that inside and out, backwards and forwards, and how to use the spacer. Monitor peak flow, assess for signs of worsening symptoms. That is your job as a nurse. You must be able to understand and teach and guide them on how to use the inhaler. Now, complications that may arise from treating this condition, condition itself, respiratory distress, if we don't get a good hang of it, or if the medicine doesn't work, or if we're looking at other issues, meanwhile something else is happening. That's why thorough assessment is necessary before we actually intervene. Status asthmaticus. Side effect from corticosteroids may also happen. Like what I did, key side effect, you have to know this for any exam. With corticosteroids, oral thrush, osteoporosis, those are the two classic, among many others, two classic side effects that we can encounter from corticosteroids. Oral thrush and osteoporosis. Very, 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 very important for any exam in nursing and, of course, any national exam. The second disorder we're going to talk about is the COPD. That is the chronic obstructive pulmonary disease. What meds do we typically use for COPD? Bronchodilators, corticosteroids, oxygen therapy. Listen, don't forget, bronchodilator is the class. These are the babies underneath the class. These are the drugs underneath the class. You have to know your drug and know your class. For every kid, there is a mother. If you know these kids right here, you have to know the mother that gave birth to them. So salmeterol, ipratropium are the two of the drugs underneath bronchodilator, but there are a lot more. Corticosteroid prednisone is an example of the drug underneath corticosteroids. And then we have oxygen therapy. That target will be 88 to 92%. We know they're having airway issue anyway, so we're not expecting anything high. In addition to that, COPD, they breathe. They are, hypoxic. They have this hypoxic drive. We don't want to drive their O2 too high because that one has a lot of implication too. So we want to make sure we keep it at 88 to 92. And that's why we don't go beyond 6 liters also whenever we have to give them nasal cannula. Now, what's your role for a patient with COPD? You want to monitor oxygen therapy, ensure appropriate titration, educate on smoking cessation. That kind of got them here to start with. Tell them how to do breathing exercises like pulse breathing. Complications, respiratory failure, pulmonary hypertension, core pulmonal, COPD exacerbations. These are the complications. You have to know the complication. Apart from complication, we left patho out. In our main review, we do talk about pathophysiology. What I'm talking about right now is not all inclusive. It's just something to listen to every day, at least to make you feel connected with some of the conditions that you're going to encounter on the exam. Pneumonia is another thing. What medications do we commonly use in treating pneumonia? Antibiotics like ceftriaxone, azithromycin for bacterial pneumonia. What about antiviral or Stomavir for viral pneumonia? So the mistake we want to ever make is to be giving antibacterial when somebody has viral infection, or give antiviral when somebody has viral infection, bacterial infection. So we have to pay attention also to the stem of the question. What exactly are they asking about? What is the organism that we are trying to target? You have to target the organism with the right drug. Nursing role, what's your job? What's your role? When you are managing somebody with pneumonia, you must assess for lung sounds, you must monitor for hypoxia, you must encourage deep breathing, coughing, hydration. What are the complications that patients are most likely going to encounter? Sepsis, pleural effusion, respiratory failure, lung abscess. These are things that can potentially happen. Another pathology is pulmonary embolism. With pulmonary embolism, what medications do we need to tap into to support them? Anticoagulants, thrombolytics. Again, knowing anticoagulant is not enough. Knowing the kind of drugs that we have under anticoagulant is important, because you may not get the exact class on the exam. They may just throw warfarin or heparin on the exam, and you have to be able to pick it up. That is an anticoagulant. Thrombolytics, alteplase for severe cases. What is your job as a nurse in managing somebody with pulmonary embolism? You want to monitor for signs of bleeding. You want to adjust anticoagulant therapy. You want to elevate the legs. You want to encourage ambulation to prevent deep vein thrombosis. Listen, pulmonary embolism, the word embolism is a clot. When this clot breaks loose, it can go anywhere. It can go to the heart. If it goes to the heart, it forms a heart attack. If it goes to the brain, that is going to cause a brain attack, aka stroke. That's what it is. So embolism is a big deal. So that's why we have to encourage them to elevate their legs. We have to encourage them to move. The more they move, the more they keep the blood circulating, and then we can prevent DVT. What complications can we get from pulmonary embolism? Hemorrhage, recurrent pulmonary embolism, of course, right heart failure, and so on and so forth. What about tuberculosis? With tuberculosis, what medications are we going to need to take care of this patient? Rifampin, isoniazid. These are generally the first-line drugs. And what about the DOT? You're like, what in the heck is DOT? Okay, that is directly observed therapy, DOT, to ensure that they are adhering to their meds. And of course, what is your role as a nurse for somebody with tuberculosis? You want to monitor side effects, e.g. liver toxicity. You want to educate on adherence, isolation during active disease phase. They have complications as well. And that will be, they might be resistant to the treatment, like drug-resistant tuberculosis, liver damage, multi-drug resistance also is a possibility. The next disorder is going to be pleural effusion. With pleural effusion, what treatment do we need to use? Thoracosynthesis to remove fluid, medications like diuretics, corticosteroids. Nursing role, monitor respiratory status and vital signs, educate the importance of regular follow-ups. What are the complications that we may see with pleural effusion? Infection, reaccumulation of fluid, pneumothorax. These are the things that we see with pleural effusion. The next patho that we're going to be talking about is acute respiratory distress syndrome. And how do we fix this condition? Mechanical ventilation without a doubt, prone positioning, medications will be like sedatives and paralytics. This is a very, very, very serious condition, ARDS, acute respiratory distress syndrome. What is your role for managing this patient? You want to monitor the vent settings, so we have to know the vent settings without a doubt. You must be able to assess for any kind of complications like barotrauma. You want to provide support for family and patient, and complications could be a VAP. You're like, what is a VAP? That is ventilator associated pneumonia. There are also other issues that we may get, so we need to do a good oral care too to prevent other kind of infections. And then also organ failure is a possibility. Barotrauma is also something to watch out for. The next patho that we're going to be talking about is cystic fibrosis. Cystic fibrosis, we know it's one of the lung diseases that we use mucolytics for, inhaled antibiotics like tobramycin. And of course, what is your role as a nurse? You want to educate on chest physiotherapy, enzyme replacement. You want to monitor respiratory function, nutritional intake, And of course, what are the complications? Respiratory failure is a possibility, diabetes, osteoporosis, frequent infections. This is not uncommon when we have cystic fibrosis. Now, what about bronchiectasis? Bronchiectasis is a medication that we do is like antibiotics for infections, bronchodilator. Airway clearance is important. Postural drainage precaution. Monitor for signs of infection or any kind of worsening lung infection. Recurrent infection, respiratory failure, hemoptysis is all important to watch out for. So the 10th disorder we're going to talk about is lung cancer. Surgery, chemotherapy, radiation are the best ways to kind of intervene while it's still early or while things are manageable. Medications, chemotherapeutic agent like cisplatin, paclitaxel are other things we can do. What is your role as a nurse? You want to support pain management, emotional support for patients and family. You want to educate on smoking cessation. You want, and of course, post-surgical care. Complications, it might spread. That's meds. They might be, they might be experiencing some side effects from the treatment. Unfortunately, they might also have difficulty with breathing. Pulmonary hypertension is the next thing we're going to talk about. How do we manage it? Vasodilators like sildenafil, endothelin receptor antagonists like bosentan. What is your role as a nurse? Monitor for adverse effect of vasodilators. Educate on the importance of fluid balance, avoiding high altitudes. That is key. Avoiding high altitudes. What are the complications? They might go into right-sided heart failure, arrhythmias, thromboembolism. What about pneumothorax? You want to treat, of course, you have to relieve the pressure with chest tube insertion, oxygen therapy. Your role as a nurse, what are you going to do? You want to monitor chest tube drainage, respiratory status. You want to assess for signs of tension, pneumothorax. Example, tracheal deviation and hypotension. Complications of pneumothorax, recurrent pneumothorax, infection, respiratory distress. Now, sleep apnea is another condition that we have to think about. Treatment is CPAP, continuous positive airway pressure therapy. What is your role as a nurse? You want to educate on CPAP usage. You want to adjust settings as needed. You want to monitor for skin breakdown, ensure adequate mask fit. Complications, cardiovascular disease, hypertension, daytime fatigue, and all that. This is now 12 minutes and 40 seconds. And guess what? We went over quite a lot. We went over asthma management, COPD management, pneumonia management. We went to pulmonary embolism, tuberculosis, pleural effusion, acute respiratory distress syndrome, cystic fibrosis, bronchiectasis, lung cancer. We also went through pulmonary hypertension, pneumothorax, sleep apnea, right? And now we are going to go right to the meds that we generally use in respiratory system or with respiratory system. And not only the drugs, we're also going to talk about the common side effects that patients may encounter, as well as potential interactions and teaching points. Speaking is Dr. Kehinde Elisha, founder and CEO of NP Certification Academy. To reach us, nurse-to-nursecoach@gmail.com or visit www.npcertificationacademy.com. We have 99.9% pass rate, and we look forward to you joining this circle of exam success. At this time, we're going to get started with pharmacology. Are you ready? Let me see if my note is not lost somewhere. All right, so now the first drug we're going to talk about. Okay, now we have the conditions. What do we do for asthma? Albuterol, fluticasone. Let's talk about those two drugs. So for asthma, what are the things we need to watch for? I'm going to make sure I circle here so you will know exactly what to focus on or what frequently shows up on any exam. That way you will know, at least hopefully I can narrow it down for you. Just give me a second here. Let me pick up my pen, okay? You know you are getting tremors for sure, okay? It's a little bit too thick. You know you are getting tremors for sure. Tachycardia is a sure thing. Nervousness and headache. All of these are actually important. I can't really rule anyone out. That's what we see with SABAs, okay? What is the potential interaction then? Beta blockers. What does that mean? First of all, they're saying, okay, beta blockers may decrease the effectiveness of MAOIs, may increase risk of side effects. That's not the only thing. Whenever we have asthma, and you know, it is a beta blocker, but it also can cause what? Bronchospasm. So we need to avoid beta blocker in somebody that already have a narrowed airway like asthma. They will test you on that. It's a contraindication. Don't do it. Somebody's gonna die. So anytime you suspect that somebody's gonna die, you want to avoid doing such. How do you teach your patients then? You want to teach proper inhaler technique. Use spacer monitor for tachycardia. This is also relevant, but what I want you to hold on to is the fact that beta blocker and asthma do not go together because of bronchospasm. What about fluticasone, hoarseness, oral thrush, cough, increased risk of what? Pneumonia. These are things that we can potentially get as a side effect of fluticasone. Hoarseness and oral thrush is very, very common on the exam. Oral thrush with steroids, oral thrush with steroids will be on your exam. You got to know it. So use with what? CYP3A4 inhibitors can increase serum levels. So here we're talking about more of drug-drug interaction, and of course, how the level can go up when we mix with inhibitors like ketoconazole, and then that will give us more dose that we really want. That is the drug-drug interaction that we can see here. But the key point that you need to know for tests is the fact that you have to rinse your mouth anytime you take corticosteroids because of that thrush, right? You have to rinse your mouth after you use to prevent oral thrush. So you can prevent the oral thrush as long as you rinse your mouth after each use. Now let's talk about COPD. COPD, we can use salmeterol. We can use ipratropium. Salmeterol happen to be what? A LABA. What is a LABA? LABA means long-acting beta agonist. And what can we see as a side effect? Tachycardia, headache, nervousness. And of course, what is the interaction that we may encounter here? It may encounter with other sympathomimetics like beta blockers. So you're going to use as prescribed for long-term control, not for acute symptoms, for long-term control. All right. Now, ipratropium, dry mouth, urinary retention, blood vision. You want to hold on to blood vision. Everything is dry with anticholinergic. With anticholinergic, everything is dry. Dry mouth. So now you don't have enough water in your body. Now you are retaining the urine in your body because you don't have enough to pee out. That's a way to try and remember that. Well, my eyes are so dry and so blurry because they are so dry, there's no fluid in it. So everything is dry with anticholinergic. Now, what about increased anticholinergic effect with other increased anti? So that means whenever we combine with other anticholinergics like atropine, it's gonna, of course, side effect will be, and it's gonna be like an additive effect. Now we have what do we do then? How do we prevent or reduce this? We have to rinse mouth after use to avoid alcohol-based mouthwash and avoid alcohol-based mouthwashes. So what about pneumonia? We use azithromycin, we use ceftriaxone, we have other drugs. This is not all inclusive, this is just some to get some out of the way. Take 2 drugs at a time and slowly expand your library. So what are the common side effects of azithromycin? Diarrhea, nausea, abdominal pain. QT prolongation, you must know that for test. QT prolongation, you have to know that for test. That is lethal. That is deadly. Why is that? We have the PQRST. We have the PQRST, right? Sorry for my drawing right here. So now when we have a prolonged QT prolongation, guess what? This is going to look like what? Instead of PQRST, it's going to look like this. It's going to start looking like this. It's going to start looking like, by the time you know it, we have McDonald's, which is VTAC. So anytime we see QT prolongation, you got to pay attention. It's a safety issue. Make sure you know which drug can cause QT prolongation so that you can avoid combining with another drug that will also cause QT prolongation. That will not, produce a good outcome for our patients. The next one that I want to talk about is ceftriaxone, diarrhea, rash, allergic reactions, thrombophlebitis. I will hold on to thrombophlebitis and allergic reaction. Those are the 2 common ones that they focus on the exam as a side effect of ceftriaxone. Ceftriaxone, thrombophlebitis may interact with anticoagulants, and then bleeding risk might be higher. So you got to watch out for signs of allergic reactions. You got to monitor for renal function. And then we have pulmonary embolism, heparin, bleeding, thrombocytopenia, osteoporosis are one of the side effects. NSAID and aspirin can increase bleeding risk as well. We got to monitor for signs of bleeding or any kind of bruising or even dark stools. So whenever somebody is on heparin, watch out for dark stools. Dark stools and bruising, extremely important for the exam. You can guarantee that will be on your tests. Now, what about warfarin? With warfarin, bleeding, nausea, air loss, liver damage are the side effects that we can encounter. And then it's going to interact with many drugs, antibiotics, and so on that can alter vitamin K levels and so on and so forth. So I think the rest is just pretty much general. But let's talk about rifampin, though, that we normally use for tuberculosis. Hepatotoxicity is one of the side effects. Orange discoloration of bodily fluids. It can interact with oral contraceptives, warfarin, and certain antiretrovirals. We got to monitor for liver function. Use alternative birth control methods if you can. And of course, isoniazid. Isoniazid is an anti-tuberculin too. And of course, hepatotoxicity, peripheral nephropathy, increases the levels of phenytoin and can cause liver toxicity. Guys, this side effect is ridiculously high, but I do understand what we need, right? So what is the main teaching here? We got to be taking this with vitamin B6. Don't forget, this is frequently tested. You got to, when you're on isoniazid, you have to take with vitamin B6 to prevent neuropathy. And you have to also monitor for what? Liver symptoms. What about cystic fibrosis? Donase alpha mucolytic, pharyngitis, laryngitis, voice alteration are the main side effects that we experience here. You got to avoid in patients with a history of allergy to Chinese hamster ovary proteins. And then you got to teach proper nebulizer use, ensure adequate hydration, and so on. And then cisplatin, anytime you're taking anything for, you know, what's it called? Cancer, nausea, vomiting, you can be guaranteed. That's one of the effects. Nephrotoxicity, myelosuppression. It may interact with other nephrotoxic agents like aminoglycosides. Pre-medicate for nausea, encourage hydration to prevent kidney damage. Now, paclitaxel, neuropathy, bone marrow suppression, alopecia, increases effect of warfarin, may interact with CYP450 inducers and inhibitor. What about pulmonary hypertension? We can use sildenafil, which is phosphodiesterase inhibitor, bosentan, endothelin receptor antagonist. This sildenafil have a few side effects like headaches, dizziness, flushing, hypotension, and it may interact with nitrates, example nitroglycerin, leading to severe hypotension. Do not use with nitrates. Avoid alcohol to reduce hypotension. Do not use sildenafil with nitrates, and you need to avoid alcohol to reduce hypotension. What about pneumothorax? Oxygen therapy. Oxygen toxicity is possible. So when giving oxygen to our patient, let's be very, very careful. Let us be very, very careful. It is rare, but it's possible. It is rare, especially when we're using it short term, but for long term, let's just not crank up oxygen anyhow. So excessive oxygen in COPD patients, of course, can lead to respiratory depression. Remember I said earlier that the hypoxic drive is actually low O2. So we don't want them to be 100% to breathe well. Now, sleep apnea, CPAP, continuous skin irritation, dry mouth, claustrophobia, those are things that they tend to experience. We got to ensure proper mask fit and educate on consistent nightly use. So what are the key points here for teaching your patients? Emphasize adherence to prescribed medications. Correct inhaler techniques is necessary. And importance of regular follow-ups. Side effects awareness. Educate patients on potential side effects and when to report them. Drug interactions highlight the importance of informing healthcare providers about all medications, including over-the-counter drugs and supplements, to avoid harmful interactions. Lifestyle modifications for conditions like COPD and asthma, stress, smoking cessation, diet adjustment, and physical activity as part of the overall treatment plan. Monitoring: instruct the patient on the importance of monitoring symptoms, especially for complications like bleeding, respiratory distress, or changes in urine output with nephrotoxic drug. That ends the pharmacology of respiratory system and the 13 respiratory disorders that we just went over. I really hope this is helpful. If you find it helpful, please let us know. And most importantly, please don't forget to subscribe to our channel here and spread the word. www.npcertificationacademy.com or email nurse-to-nurse-coach@gmail.com. You can also call us 347-901-6037. Dr. Kehinde Elisha speaking here. Thank you so much for taking time to listen. Have a wonderful day. Bye-bye.